Welcome back for another issue of DermTube Daily coverage from the American Academy of Dermatology. With us today is Dr. Terrence Keaney, who is a dermatologist at the Washington Institute of Dermatologic and Laser Surgery. Thanks for joining us. I know you run their clinic on men's aesthetic treatments, and you've been discussing that here at the American Academy of Dermatology. There's definitely differences in the way that we approach a male aesthetic patient versus a lady aesthetic patient. Can you take us through some of the things that you think about when you see these patients?
Absolutely. Thank you for having me, Dr. Cohen. Whenever you're examining a patient for any cosmetic procedure, you're looking at their anatomy. And really what differentiates men from women is the differences, particularly when you talk about the face, the differences in facial anatomy. And those differences extend from the bony skeleton, the soft tissue, and the skin. And when you really, I always say you start from bottom up. So if you look at the male skeleton, it's a different shape in that the cheeks have less anterior projection and a more what we call lateral flare. So men's mid-face is flatter and wider. What's also wider is the jawline, so we have a wider jaw and chin. Therefore, at baseline, men tend to have a more boxy face. And traditionally with women, we talk about that heart-shaped, youthful shape. So from the start, men's face is different in shape. And then you add the effects of aging, lends credence to the idea that we should be treating these men differently just based on anatomy and how they age differently. And so that's why we look at genders very differently in our practice.
We have a full portfolio of things that we can offer to our aesthetic patients, and it's always nice to sit down with them and talk to them about some of their options. When you see a male patient, really, how do you see them starting as opposed to a lady patient, and what types of procedures do they want to do first? Minimal downtime or maximal improvement type of procedures?
Well, the initial consultation with any male patient is actually very different than a female consultation because men are less educated about the available options. And so I spend a lot more time in education. And then I go through very clearly the different procedures we can offer with an extensive discussion on side effects. Because typically most men are working high pressure jobs, and I find that downtime is a big issue, and unexpected surprises in terms of side effects are not something they tolerate well. So education at initial consultation is extremely important. So if there is a procedure that is really indicated for them that requires downtime, it's not like men won't do it, but they need to plan accordingly, and they can't be surprised also in that they need a week off when they weren't anticipating it. So, education is very important when you're treating a male cosmetic patient.
I definitely have male patients who come in who really know exactly what they want to do. They're worried about the lines and wrinkles around their eyes, and they want to just go for the treatment that they're going to see results. I think it's difficult to get those guys after they've had a good treatment like that and they see improvement on sort of maintenance treatments. Do you have any tips that you do to really engage them in the aesthetic practice things that we do on a regular basis, from peels to microneedling or things with really maintenance type of focus?
Absolutely. There's a couple strategies that I use. I appeal to their wallet. So I say, you invested in this initial procedure, you spent the time, money, and effort, you took off time from your work, and you want to preserve that. You don't want to have to go back and do that. So I say there's easier ways to preserve the results of that procedure, or to minimize the need for that down the road. So that's really how I appeal to the finances first, and then I stay after them. Sometimes men, their work gets caught up with them, work, family life. So I make sure our office is follows up with them, and we make sure that they know that their appointments are coming up, or they should be reevaluated.
Thank you very much for joining us, and we appreciate all of you being with us again for another issue of DermTube Daily coverage from the American Academy of Dermatology.